Good afternoon. Hello, Facebook fans. Welcome to Let's Talk V, Talk with a Doc Facebook Live series. I am Dr. Aherrera, and I will be your guest speaker this afternoon to talk about the most exciting topic, an intimate topic, too loose, too tight, or just right. By the way, if you have questions but you're just too shy to send it online, you can send it through a private messenger to Let's Talk V page and we will answer them later. So before we start, let me just give you an idea of who I am. I have been practicing for 28 years in the specialization of obstetrics and gynecology, and I have encompassed all the phases of a woman's life cycle, from childhood, adolescence, adulthood, childbearing years, premenopausal, postmenopausal, and the geriatric years. And so I find it is time to be cognizant and make you, women out there, aware of what's been happening to your body. It is time to get that liberating feeling. And before we can do that, to feel good, to feel fabulous, to be vivacious and vibrant, it is very important that you understand the complexities of what makes you female, the female reproductive system. So, here I have just an example of the female reproductive system. You will find this internally in your body. This is your uterus. This is where the pregnancy grows. You have the fallopian tubes, where this is the site of life. This is where fertilization takes place, where the egg that comes from the ovaries and the sperm that is deposited in the vagina meet. Now, let me make you understand that women go out, seek their doctors, consult with them because of any of the conditions they feel about their uterus, fallopian tube, and the ovaries. And this is the cervix. However, the vagina, which is actually internally, that is an intimate part of the female reproductive system, women are just too shy to talk about it amongst friends, colleagues, and even doctors. And the vagina is the most neglected part of the female reproductive system. Let me make you understand. Without the vagina, tell me, you will be the most unhappy and the most miserable person in the world. The vagina is the expression of one's femininity. Furthermore, it allows, in the youth, it tells us that it is the reproductive outflow tract that allows childbearing women, one, when they menstruate, blood is flowing out into the vagina, so it's an outflow tract. Number two, it is a conduit for women to enjoy life during sexual intercourse. And three, it also is an outflow tract for childbearing women during childbirth. However, like any part of the female body part, the face, the body, extremities, the vagina also goes through a winding down biologically in the process of aging. And so the vagina becomes vulnerable to changes, to intimate dysfunctions that I will talk and discuss to you this afternoon. So it is important to understand that the vagina is a closed muscular tube. It is God's gift to us because there is life an activity that exists within that cavity. It is equipped with its own delicate system because it knows how to clean itself. Okay? Sa Tagalog, para siyang bibig. May saliva siya, nalilinis niya yung bibig niya on its own. Okay? So, understand clearly this afternoon that the vaginal health is part and parcel of a woman's overall health status. So, let us discuss what actually makes us healthy vaginally. 1. Vaginal health is dependent on the pH balance. Pag sinabing pH, it's actually a measurement of a certain solution, whether acidic siya or basic siya, alkaline. Okay. The vaginal health is dependent on acidic environment. It is actually, the pH is acidic at 3.8 to 4.2. So, let me make you understand that vaginal health is dependent on 2 factors. 1, in a normally menstruating young woman, it is dependent on the female hormone estrogen. And number 2, intindihin nyo, in the vagina, meron yung normal bacteria. Ang tinatawag dyan, lactobacilli. So, for you women out there, normally menstruating, you have both estrogen and lactobacilli that keeps your vagina at its optimum. Pag sinabi maximized, physiologic, that is the best vaginal health status that you are at. Now, do you know that the pH of the vagina in different phases of a woman's life cycle changes? Example, in the very young and yung mga menopause na, they have the same pH. Why? Because in the very young, they're still not menstruating. So that means there is low to absent estrogen levels. Also, in a menopausic woman, where there is already an insufficiency of the estrogen hormones due to the retirement of the ovaries, the pH of the vagina changes. So understand, extremes yan. In the young and in the old, the vaginal pH is 7, but in between, normally menstruating, you have very good levels of estrogen, and you have your existing normal bacteria. The pH of the vagina is at its maximum. Now, you can ask me, ano ba talaga ang role ng estrogen? Okay. Ang estrogen, parang lotion yan sa katawan. The estrogen nilaline niya ang cells, the surface of the vagina. And because there are existing normal lactobacilli bacteria in the vagina, okay, it actually feeds on the estrogen-lined cells. Meaning to say, yung estrogen, nagiging pagkain yan ng lactobacilli. At pag kumain yung lactobacilli ng estrogen cells, what happens? There is a breakdown or a byproduct called lactic acid. It is lactic acid production that maintains the acidic pH of the vagina. Again, you have estrogen, nagiging pagkain ng lactobacilli. It's breaking down into lactic acid. It's the lactic acid that's important. Okay? When your pH is acidic, it prevents infection anywhere from the butt and the outer external portion. Okay. So, I've already discussed quietly and simply just a little of the anatomy, or let's say the science of vaginal health. But that is not just what makes us a woman. I spoke about the female reproductive system internally found in our body. However, what makes us different from males is what we call the vulva, the external genitalia sa labas. So let me emphasize that the reason why I have to do this, because almost in a survey that was done recently, women don't even know where the vagina is. They think the vagina is where the urine passes. Okay? So I am here to help you understand that the vulva, which is the external genitalia, is not the vagina. I've explained that the vagina is a muscular tube. Okay, ano yung vulva? Ladies out there, tonight I want you to look at this. God gifted us uniquely with two faces. One up and one intimately hidden down below. Okay, to understand it further, okay, let me get my other model. So, kunwari mukha yan, ha? Okay, this is the external genitalia. Okay? So, this is your face. The external genitalia consists of the labia majora, yung mga pisngi. So, para siyang cheeks, pisngi natin. Yung labia minora, yung maliliit na labi, nandito yan. So, it is actually in between the crease of the vagina and the base of the nose. Okay? So, this is your vulva. This is your vulva. At the tip, or the bridge of the nose, is the clitoris. If you follow it midline, down, at the tip of your nose, yun ang daanan ng ihi. That's where the urine passes. Dito. And further down, yung bibig is the vaginal opening. So, hindi yan ang vagina. Yan ang puerta. Pag sinabing puerta, it's a door. So, it's an opening. Okay? Now, this part, which is the chin, like your face. Kung wala kang chin, babagsak ang iyong muka. Ganon din siya. If you don't have that perineal support or the chin, your vulvar structures will also sag. So this is your perineal support. And your anus, okay, kung saan lumalabas ang dumi, ay nandito sa likod, sa ilalim ng chin. So take note, this is your vulvar structure, your vaginal opening called the introitus, yung puerta. Ang vagina is this, a muscular tube. Okay? Alright. Now, why is it important for me to talk about this? Because the vaginal health, okay, to maintain its strength, its tone, and its control, you have ligaments. Okay, para hindi kayo ma-confuse, ha? Okay. Ito yung daanan ng ihe, the urethra. If you follow this, that's the urinary bladder. Yun ang pantog na tinatawag. Pag binaba mo, ito yung vaginal opening, ito yung puerta. Okay? Kita nyo, ito na yung cervix. Yan, yan, cervix. This is the uterus. So, nakita mo, uterus, nasa loob siya ng katawan. Ito, nasa labas. Diyan lumalaki yung pregnancy. Diyan that's where pregnancy develops. And then, you have your fallopian tube and the ovaries. Furthermore, ito yung puwet, yung butas ng puwet. Pag finalo nyo, yun ang bituka. Okay. So, I'm showing you the anatomic areas, relationship So you will understand the following changes that will occur in your body through different instances. So, let me explain. Yung mga yellow na yan, yun ang mga ligaments. Yun ang mga muscles that put to place the vagina. Take note. Look at that. That is the canal. The vagina, in a normal state, has about 1 to 1.5 finger breadth diameter. That's the diameter. Okay. The vaginal canal is pointing downwards. So the whole finger, that is where you can put in your finger, is called the vaginal canal. And if you feel something within the canal, that is the cervix. Okay? Now, so now that I have told you the normal anatomy and the reasons why the vagina is where it at its state, there are intimate, I call it intimate, ayokong masabing vaginal. Kasi yung intimate encompasses not only the vagina, but also the vulvar structures. So there are intimate changes, or we call dysfunctions, that occur because of 3 factors. 1, the natural process of aging. Yung sinabi ko sa inyo, pag tumatanda na ang muka, okay, katulad niyan. Sinasabi ko, 2 ang muka ng babae. Pag tumatanda na tayo, gusto natin, yung mukha natin, we will go out, seek healthy other alternatives, to look good, to feel good, to look younger than our age. Pero, nakakalimutan natin na yung mukha natin sa ilalim, naglalag behind. Maganda nga tayo sa mukha. Lagay tayo ng mga moistures, whatever, nagpapagawa tayo ng mga botox, pero our vulvar structures lag behind in age and in looks. Okay? So, let us go through the different dysfunctions. One of which is what we call vaginal relaxation or vaginal looseness. Okay. What is this due to? Remember what I mentioned? To keep it where it's at. The tone, the strength, and the control of the muscles are strong and strengthened. Kaya lang, in vaginal looseness or relaxation, bumabagsak siya, bumibigay siya, nadadamage siya, lumuluwang siya. Remember I told you about the diameter? Now the diameter has increased internally and externally. So, what are the factors that actually bring this condition? Apart from that looseness, you also have laxity of the muscles upward, upper, inner, lower, inner, and the chin. Remember, sinabi ko sa inyo, pag bumagsak na yung chin nyo, pati yung buong mukha nyo babagsak. That's the same thing. Okay. Anong conditions? What are the conditions that lead to vaginal relaxation? 1, pregnancy. There is a relaxation of the muscles. Okay. There's less tone, less control during pregnancy. What more during childbirth? Pag umiiri ka, the pressure. Because remember, the muscles stretch. So upon delivery, this actually stretches. Okay? Now, aside from this, we call urinary incontinence. Okay? I'm sure narinig nyo na yun. Nasasama yan. Pag bumabagsak na at there's looseness, there's such a thing as stress urinary incontinence or yung ihi ng ihi, hindi na kukontrol. Kailangan parating na sa banyo. What brings that about? Kunwari, tatawa ka lang, hahaching ka lang, you will sneeze. There's some form of leakage of the urine. We call them leaky urine. What is it due to? Remember what I mentioned? Just remember the anatomy of the face that I've explained to you so you will understand. Remember, the tip of the nose is the urinary opening. That's where the urine passes out. So, this is the urinary bladder. You see those yellow ligaments? When they become lax, when they become loosened, they also lose control. So when that happens, you have urinary incontinence. Okay? This can even happen, kunwari, tumatakbo ka lang or naglalakad lang, biglang may lalabas na ihi. It's secondary to the looseness in the vagina. Now, so there is really a relationship of looseness to urinary incontinence. Now, in another condition, you might ask me, Doktora, paano man yung tight ang vagina? Okay. When you have a tight vagina, naturally, your vagina is at its optimum physiologic state. You have good muscle tone, you have good muscle strength, and who experience these? These are women who have had no sexual debut, no sexual intercourse, but take note, it doesn't necessarily mean if you haven't had sex, you wouldn't have, it wouldn't be a tight vagina. Women who haven't given birth are also those who present with tight vaginas. Okay? Now, the next. Can looseness of the vagina, is it related to vaginal dryness? Okay. So we talked about vaginal looseness, we talked about incontinence, and we talked about now vaginal dryness. Vaginal dryness is a condition that is experienced pag tumatanda na tayo. O, ano yung rason? Bakit nagda-dry? Sige nga. Okay. Correct. Estrogen. There is a lack of estrogen. So, vaginal dryness is results as you age. Okay. It affects women who are menopausic. All right. Even in women who are normally menstruating, they might say, hindi pa naman ako menopausic. Hindi pa naman ako menopause, may regla pa ako. Bakit may instances na dry? Okay. Please understand, immediately after your period or immediately right before your period, the levels of estrogen are low or absent. That's why some women, when they have sexual intercourse right before their menses or right after their menses, they feel dry. That is the reason. Okay, it's hormonal now. Is vaginal dryness related to looseness? These are two different conditions. Vaginal looseness, remember, is a muscular anatomical defect brought about by pregnancy and childbirth. And not only that, it is also brought about by aging. The collagen fibers and elastin fibers that exist in the vaginal mucosa, the structural framework also becomes insufficient. So bumabagsak din ang vagina into a condition called vaginal looseness during the aging process. Now, how will you know if you are loose? You might ask me. Well, the only time you will be able to experience this, of course, is there's a feeling of not so tight, but feeling of looseness during sexual intimacy. Okay. This is experienced during intimacy. Now, what about vaginal flatulence? Okay. Paminsan, dahil loose siya, Remember what I mentioned? Let's go back to the anatomy and the physiology. Nagsistretch to. It not only stretches sideways, it also stretches upwards and downwards. So you don't only have urinary incontinence, but the area where the anus is, the posterior vaginal wall, bumibigay din yan. So lumuluwang. So paminsan may hangin na lumalabas. Parang umuutot siya. So ang tawag doon, vaginal flatulence. You know, when you have these conditions, it's really frustrating. Paminsan napapagod kayo, or sometimes you feel despondent, nagiging depressed kayo. Don't, okay? It may be frustrating, you're not able to enjoy life kasi hindi kayo maka-exercise, tatakbo lang kayo, may lalabas na ihe, or you can't even do your ordinary tennis or yung mga ordinary physical activities because you have to be near the bathroom. Wait, there are solutions. There is a way to make you feel better. So, you might want to see, and probably you've already Googled the available solutions out there, like topical creams, lubricants to relieve dryness. It could be temporary relief, but not permanent relief. Kegels exercises, alam niyo yun, di ba? Yung look at the mirror and then squeeze. Sometimes you might not even be doing the right thing. And how many do you need to do to be able to achieve that tightness that you want? Okay. So, you might even ask, what about natural extracts that you might read outside and that promise tightening of the vaginal muscles? Natural extracts with no FDA approval, online registration. Let me make you understand. Before you get into this, intindihin nyo yung physiology, intindihin nyo the science behind the solution of the product to address the intimate change or dysfunction brought about by any of the changes that I told you. So if there is no scientific reason, please lang, those products will not work. So I can safely say it will not work. I'm sure many of you have heard of vaginal aesthetic rejuvenation. These are vaginal restorative procedures surgically that could treat and address 1. Vaginal looseness, excess skin. Merong iba dyan. You can look tonight. Your labia minora might be extending, protruding over your labia majora. Ang tawag doon, hypertrophy of the labia minora. There are procedures called labiaplasty to be able to address these irregular genital structures. Vaginoplasty, it is addressed surgically also by maybe laser or by radiofrequency. These procedures may range from 30 to 90 minutes. The only disadvantage of this, may downtime to. Restrictions, gym exercise, and downtime, no sexual intercourse for 6 to 8 weeks. Let me tell you that in my aesthetic gynecologic practice of more than a decade now, 80 to 90% of women go out and seek consult for any of these conditions. A functional impairment, yung ihi ng ihe, okay? Or aesthetic reasons, those hypertrophy, okay? However, I am so proud to tell you that there are some women who may not have to undergo surgical intervention but are suffering quietly because of the natural process of aging. Ang tingin nila sa buhay, wala na silang pag-asa. Yung iba hindi nang nangangailangan ng operasyon. So kala nila naiwanan na lang sila ng panahon. Youth has left them. But let me tell you the good news, that there is, ang tinatawag nila, temperature-controlled radiofrequency procedure using Thermiva. It's non-surgical. Ibig sabihin nun, hindi yan inooperahan. It's non-invasive because, let me tell you, it is only here in the vaginal canal and in the outer external feature of the genitalia that address the following: vulvo, meaning to say the vulvar, vaginal laxity or looseness, okay, dry, very dry vulva or dry vaginal area. It can also increase, or you have loss of sensitivity and support here in the perineal area. So this is not only for functional or aesthetic reasons, but it addresses the natural process of aging. Please understand, there is no cure, no permanent cure for vaginal dryness. You need to understand you can get help by using and engaging in what we call radiofrequency Thermiva. What is it? There is a machine, okay, that transmits heat into this, tinan nyo, wand-like S shape. At the tip is a heated plate. The heat is transferred to the heated plate, and this is used to massage and deliver the energy in stroke-like manners. By the way, it is S-shaped, so this is patient-friendly. It follows the curvature of the vagina. Can you see it? So, the heat is transferred and delivered here, equally treated around the affected area. It is another science. So, hindi to gawa-gawa lang. May rason. There is the science of heat. The heat actually shrinks the skin and thickens the mucosa. So, it not only stresses or concerns or addresses the vagina, even the vulva. Here, yung mga nagsasag na. Because the collagen fibers and the elastin fibers that become insufficient during aging, the heat massage, okay, stimulates and increases circulation, blood flow, not only in the labia, but around the clitoris. And a secondary benefit, it improves sensitivity and better friction during intercourse and increases orgasmic activity. So remember, Thermiva, as the term says, thermi, heat, va, in the vagina, it enhances not only tightening of the skin, but also tightening of the collagen. The procedure takes about 20 to 30 minutes, 10 to 15 minutes in the labia, 10 to 15 minutes in the vagina. It's a 3-session therapy, 1 month apart, and since it is friendly to patients, there is no downtime, no side effects, no pain, no blisters, and resumption of normal activities like sexual intercourse. And so, today, I am so happy to tell you that Let's Talk V is hosting this event, and hopefully you have learned so much about vaginal health. So, is anyone out there, ladies, experiencing any of the following? Looseness, incontinence, dryness, and it's stopping you from engaging in your physical activities. Please, you are not alone. You need not suffer quietly. Huwag niyong titiisin. It is time to come out courageously and help and seek help where and when possible. Be assured that there is a way to make you feel better. So for any follow-up questions or you want to seek consultations, please come and visit me.
Online question.
Okay? All right. Before I say goodbye, let me just answer some online questions.
Send to private message.
Okay. These questions were sent through the private message. 1. I frequently experience itching in my vagina, which also leads to swelling sometimes. I am very worried about this. Please help. Okay. I'm sure now, mas naintindihan mo na. The reason why there is itching, because your vagina is not at its optimal physiologic state. 1, there's probably a disruption in the vaginal pH. That's why there might be more than just the good bacteria around the vagina causing itching. And the swelling may be secondary, probably because you have been scratching from the itch or because of some form of inflammation going on. You will have to consult so that you will be able to be assessed appropriately and see if there is any vaginal discharge that comes along with the itching symptoms, and then be given appropriately medications, antifungal or antibacterial or probiotic vaginal capsules. Okay? Next, I recently had a baby. By the way, thank you for your question. I recently had a baby. However, I am concerned that my vagina may not be as tight as it was once. Can you please give me a solution? This is a very common occurrence. Okay. If you had a baby vaginally, as I have mentioned to you, anatomically, those vaginal muscles have relaxed, okay, have loosened, okay, and have lost control. And it is no longer you feel you are in the post-virginal state or pre-pregnant state. The best solution for you, if you want to achieve some tightening and you think you still want to have kids, the best would be your Thermiva. Your Thermiva is the science of heat, as I've mentioned. It will give the tightening of the vaginal mucosa because of the heat transfer from the machine and into all these tissues. Okay? Now, if you have already decided that you have completed your family life, then you can consider a surgical procedure to have that tightening effect. Okay? Thank you. Third question. My vagina has widened quite a bit, and this makes it less pleasurable for my husband while having sex. Can vaginal tightening creams help? As I have mentioned to you, vaginal tightening will only occur if there is thickening of the mucosa or there is really an active surgical approximation of those muscles. The creams could be temporary, maybe an effect, but not the effect that you would like to achieve, the pre-pregnant, post-virginal state. Let me make you understand, if there's vaginal looseness with some form of dryness, estrogen cream might be able to help temporarily. Again, to address this, you will have to consider your other options and not the vaginal tightening creams. I'm 18 years old. My vaginal lips are very black and loose. There is some white substance inside it. Is this normal? Okay. My dear 18-year-old, you will have to be examined to be able to, for the doctor to be able to assess what it really is. If it is black and there's white substance, it really just might be blackheads or whiteheads. But if it is loose, we have to understand there is something there that you might think is abnormal, and to address this, like might be labial hypertrophy, please come and seek consult. Okay? You can go and see your doctor, seek consult to address this permanently. Okay. My vagina is very loose and wide. Please suggest a medicine or exercise or any kind of treatment to make my husband happy. The same reason I gave to question number 2. If you feel that this is already the time when you have completed your family life, you have 2 options. A non-surgical option where you can undergo thermiva, again, the tightening, okay, and the shrinking, where you have the youthful appearance and you can achieve an optimum physiologic state. That's one. Or you can undergo a non-surgical procedure where there is reapproximately of the tissues, so it can achieve a tightening effect of the vulva, the perineum, and the vagina. Exercise. Kegel's exercise, as I have said, it may help, but this is just temporary. You will probably need to do a lot, 15,000 counts to probably tighten that up. And please take note, I know you are young, whoever asked this question, but as you age, nawawala din yung estrogen then. So it will not only be loose, it will be tightened. So you will really need to consider a non-surgical radiofrequency procedure. Next, will using KY jelly and having sex help widen my vagina? KY jelly as a lubricant may help, may ease the entrance of the penis into the vaginal introitus. But to help widen the vagina, KY jelly per se will not widen the vagina. What will widen the diameter of the vagina would be the friction, the continuous friction during intercourse, continuous, we call that trauma, or it could also, from childbirth, that could widen the vagina. Okay, this is the last, but not the least. My vagina contracts in the middle of the intercourse, causing discomfort to my partner. Okay, I'm trying to understand what this question is really driving at. Because ladies, when your vagina contracts in the course or in the middle of sexual activity, sexual intercourse, it really does contract. And that is already a form of orgasm. Tandaan nyo, female orgasm, wala nang nilalabas. Orgasm is achieved when there is contraction of the vaginal muscles. So, maybe, to your knowledge, you are not having that orgasm, but that is orgasm. If it causes discomfort to your partner, then it might be a different condition like vaginismus, where it contracts very hard, with very strong pressure, that gives him pain. But contraction in the middle of an intercourse, that could already be an orgasm. I hope this helps. So, ladies out there, I hope you enjoyed our episode today. And please be assured that there is a way to make you ladies out there feel better. So for any follow-up questions or you would like to seek consult, please come and visit me at the Medical City at the Mati Building, room 1903, 19th floor. You can call at 636-4673, or at the Makati Medical Center at room 248, Tower 1. Please call at 894-1578, or you could save this number. Text or call me at 0917-589-3511. Let me repeat. Thank you for joining us, and please make sure you like and you follow Let's Talk V Facebook page. So stay tuned for the next talk with Doc Series. Bye!
Thank you.